Lately, I've had a couple of comments about the transitional and active dying phase when a patient in hospice is reaching out. And there is a common misunderstanding that this is caused by overuse of comfort medication. So let's talk about that now. Patients reaching out during the active dying phase is a phenomenon that many hospice caregivers, nurses, families observe, and it often carries some deep emotional and even spiritual significance. Let's review some of the common reasons patients reach out during the active dying. There are neurological reflexes happening automatically in the nervous system as it's shutting down. Involuntary movements can happen. So reaching or grasping motions may be simple neurological reflexes, especially if this brain is affected by low oxygen or changes in circulation. Secondly, patients may reach toward loved ones, physically or symbolically, in a natural desire for comfort, connection, or reassurance as they transition. Sometimes they're responding to sensations or even hallucinations. It is common for patients to have end-of-life visions, seeing people who have passed, or even peaceful images. Reaching out can be a response to what they perceive, even if others cannot see it. Many families and hospice staff interpret reaching out as a spiritual gesture, symbolizing a connection to something beyond the physical world, whether it's faith, loved ones, or peace. Some believe it represents a final act of agency or effort, reaching out for a loved one, signaling presence, or even attempting to communicate without words. What can you do if you are with a patient or loved one who's looking up and out and they're reaching with their hands? So gently respond to them by holding their hand, offering reassuring touch. You can speak softly and offer words. You might even ask a simple question if they're able to speak. What are you looking at? If they respond, you can even ask if what they're seeing is frightening to them or ask them to describe it. In any and all cases, honor the moment, whether you see it as biological, emotional, or spiritual. It's a part of their unique journey. And know that we, of course, want you to be giving any medications that are appropriate for this patient's comfort during transition and active dying, but know that it is not the medications that is causing the reaching out. Reaching out is a very natural and expected response in the dying patient. Thank you. Get our booklet and click on the link below. It's only $17 and it gives you a crash course in hospice, and it can really help you individualize the plan of care for your patient or your loved one. Watch all of our videos, send in your questions and comments because we love to respond. Thanks so much.